My eyelids are uneven. Is this just a lazy eye, or is there more that needs to be corrected to my eyelid? This was never a problem when I was younger, but recently my eyelids have been changing, and they're now very uneven. Is there something wrong with my eyes? How do I fix it?
Thank you for your question. The photo you submitted, with that, the question you are asking is this a lazy eyelid, you're commenting in your question that there have been changes in your eyelid, and is this something this is something that, of course, is concerning you, and so certainly there is a reason for you to be pursuing this question. Just a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I have a background in eye surgery and ophthalmology, as well as advanced training in plastic surgery of the eyelids. And so I would give you a little bit of perspective based on experience. However, since I'm limited to just a photo, I don't want you to feel like this is the only diagnosis, but I would just express to you what my concerns would be when someone reports changes to the level that you're describing, and more about the photos you've submitted. So let's look at the photos. Looking at the photo, I noticed the right eye appears to have the lower eyelid retracting downward relative in comparison to the left eye, and the eye almost appears to have more prominence compared to the left eye. Now, of course, this is a two-dimensional representation of a three-dimensional person, but the first thought that I have is is whether or not the eye is becoming more bulgy, and that whether or not this is lower eyelid retraction. Now, in the absence of any history of trauma or surgery, my first thought is a condition called thyroid-related eye disease, or thyroid-related immune orbitopathy. Another name is also Graves' disease. Now, this is a condition where there are antibodies, it's almost like an autoimmune condition where it affects the thyroid gland as well as affects the tissue around the eyes, and it causes changes in the eyes. So common symptoms or common physical appearance changes include something called proptosis, where the eye is pushing forward. It is also something called eyelid retraction, in which means like the upper eyelid can be too high, or the lower eyelid can retract downward, and the eye can appear to be staring. Now, first thing, of course, is to see a physician about these changes, and the usual path is to first see your medical doctor, and then the medical doctor would guide you as to seeing an endocrinologist and an ophthalmologist to evaluate whether or not this is something that requires to be further worked up. The Graves' disease history is usually one where a young to middle-aged person has a new onset of these eye changes and can have either low thyroid, normal thyroid, or high thyroid. But this means that this requires monitoring of blood lab tests and maybe even other imaging such as an MRI. So beyond the initial changes, which is referred to, if this is thyroid eye disease, as the inflammatory stage of Graves' disease, there is a time when it actually burns itself out, and it does also have to coincide with the management of hormone levels, and whether they're high, low, or normal. And then there's the fibrotic stage, where everything's calmed down. Now, sometimes people go back to their normal appearance, but often they need something done in order to restore closer to normal appearance. This includes procedures such as eyelid retraction repair, or orbital decompression. I mean, there's a lot. There's a lot of things that can be done surgically that a lot of times the endocrinologists don't think about because they're more concerned about the medical issues. And a lot of times they're not even aware of the surgical procedures that are available to their patients to improve their appearance. And so often people who come to us will just find us via their own search for solutions for these problems. But that's just getting ahead of ourselves. This is just to kind of give you a broad view of what my thoughts are just by looking at the photos alone. So I recommend you see your medical doctor and bring with you some old photos. When you want to document the changes, you'll be surprised that the changes could have occurred several months to years before it drew your attention. It can be slow, it can be insidious, and in some cases it can be also very rapid. So there's a wide spectrum, and the more information you have, the better informed your doctors will be. In my practice, I often will observe a patient for at least a year before even considering doing surgery if I suspect that they're still in transition, when their eyelids are not stable and the appearance of the eyes are not stable. But again, we don't want to just automatically say this is Graves' disease, but at least based on the photos, this is the thoughts that come to my mind when I look at them. But your role now is to now move forward with visiting your medical doctor and pursuing this question, and then taking it from there. If it turns out it's just laxity and other things, that's great. But at least rule out the possibility of thyroid-related eye disease. So I hope that was helpful. I wish you the best of luck, and thank you for your question.